Hello everyone, I'm Lavanya. I'm currently pursuing first MSc in Clinical Psychology at Ratnam College of Arts and Science. My topic is about Oppositional Defiant Disorder, which is abbreviated as ODD. This condition is categorized by consistent or persistent pattern of angry, irritability, argumentative, defiant behavior. Defiant behavior in the sense refuse to accept the rules, resisting to act under the authority figure, being more rebellious in a single term. Next, age of onset. Typically, the symptoms of ODD occurs during the preschool under the age of 5. Then in early childhood, it appears often at the age of 8 and become more prominent during adolescence. This is how the disorder starts to begin in each stage. As a whole, the most common age for the onset of ODD is before 8 years of age according to the research studies. According to DSM-5-TR, the symptoms of oppositional defiant disorder is categorized into three, which is anger and irritability, argumentative and defiant behavior, vindictiveness. Anger and irritability includes the individuals often lose their temper easily, frequent outbursts of anger, often get anger and annoy others frequently, and frequent disrespectful toward authority figures. And argumentative and defiant behavior is arguing with adults excessively, actively refusing to comply with requests or rules. They never follow the rules and regulations and blame others of their own mistakes. Even the mistake is occurred by them, they blame others and deliberately, casually try to annoy or upset others easily. And vindictiveness, which is taking revenge of it. If someone does wrong, they take revenge or being retaliate toward the members. Next, we're going to see about factors that influence oppositional defiant disorder, namely genetic and neurobiological factors, parenting and family environment. Under genetic and neurobiological factor, genetic inheritance, brain structure and function, neurotransmitter imbalances takes place. Genetic inheritance, where genetic plays an important role which contribute 50% of risk of being developing ODD. Even when a family have a condition of ODD or mood disorders or ADHD, increase the risk of child to develop ODD. Then brain structure and function. Some studies indicate that children with ODD have abnormal functional differences in brain regions which is more responsible in reasoning, judgment and impulse control, especially prefrontal cortex. So basically nervous system include BAS and BAS system, which is which is expanded as behavioral activation system and behavioral inhibition system. So behavioral activation system leads to driving wants to seek rewards, achieving goals, whereas BIS, behavioral inhibition system, stands for more conscious, fear of future, and being more careful and concerned. If there is an overactive and underactive in these systems, can lead to the development of ODD. Next, neurotransmitter imbalance. So neurotransmitter is a chemical which is um, released between neuron that help to send signals or transmit informations or receive messages. If there is an imbalance in neurotransmitter, this can lead to abnormal behaviors. Next, environmental factors include parenting style, family conflict and stress, parental mental health, abuse and neglect. So parenting style, there will be an inconsistent, harsh or permissive parenting, lack of supervision or lack of emotional support or caring or sharing behaviors can contribute to ODD. Family conflict and stress, High levels of family conflict, when there is a frequent family problems consistently, when they face or see problems occurring within the family, and financial problems or major life changes that can increase child's risk. Parental mental health, if a parent or a caregiver or being with a condition of mood disorder or any substance use disorder, may increase the uh, development of ODD in children. Abuse and neglect. A history of child abuse or neglect is a significant risk factor, because most of the children's experience abuse or neglect can lead to the development of ODD. Certain disorders that develop within ODD is ADHD, anxiety disorders, depression, conduct disorder, learning and communication disorders. These are all co-occurring disorders where ADHD, a high percentage of individuals with ADHD develop ODD. When the ADHD is in an extreme stage, that lead to the development of ODD. So both conditions have a high impulsivity and difficulty in emotional control. Next, anxiety disorders. Anxiety and ODD frequently co-occur. When most of the cases are recorded as ODD with anxiety disorder, or anxiety disorder which may lead to ODD. So then depression. Similar to anxiety, depression is another common co-occurring mood disorder with ODD. So it commonly it occurs with ODD. When ODD comes, the mood disorder occurs, or the mood disorder can lead to ODD commonly by the studies. Then conduct disorder. ODD can be a precursor to conduct disorder, which comes when the ODD occurs, which can lead to conduct disorder. That is what the precursor, which comes before, mostly, which involves more aggressive behaviors. So slightly, both ODD and conduct disorders have the same symptoms. Example of ODD, the film Poshempa, which is similar to ODD traits that released in the year 2019, which is based on real events of two sisters. In the movie of Poshempa, her mother had a dominating, controlling, and emotionally abusive personality. Emotionally abusive personality, in the sense, being more arrogant and cruel towards her daughters, and she used her daughters to commit crimes, um, for theft, and raising them in a violent and unstable environment frequently. So, one of her daughter developed oppositional defiant disorder, which um, which has a strong triad such as anger, defiant, hostility, and disregard for rules, which later escalated into severe antisocial and criminal behavior. In this movie, it is concluded that the mother's character heavily influenced their psychological development. Her manipulation and emotional abuse were the main causes behind their um, deviance and later violent actions. Next, behavioral therapies and counseling, which includes parent management training, cognitive behavioral therapy, family therapy, peer group therapy. Where parent management training is where the mental health professionals help parents to develop strategies to influence positively the children to come out of the conditions or manage the conditions to some extent. Cognitive behavioral therapy, the CBT. The CBT is most common therapy which is given to various disorders, where in this disorder it is promptly applied to the age category. When it is too below or small ages, the cognitive behavioral therapy will not be that much effective. When it is given to a moderate age level, it will be effective. This therapy helps children recognize and manage their anger and frustration by teaching them to identify themselves the negative thought patterns that arise within themselves and develop coping strategies. Then family therapy. Family therapy is usually given to the whole family. Is a psychoeducation about the disorder, which could give a better understanding of oppositional defiant disorder and improves communication interactions within the child's conditions. Peer group therapy, in some cases, this can help children learn socials. In some cases, which is which can help them to enhance their social skills with their peers, where they could include their peers and make them engage and being more interactive and make more them interactive, which could enhance their social skills. Medication. There is no medication to cure ODD. ODD can only be managed. So, it is not typically a primary treatment, medication is. So, it may be prescribed to treat co occurring conditions, okay, that worsen ODD, such as ADHD, anxiety, or depression, can worsen the ODD condition to extreme. So, to reduce those extremeness, we can take medications. Then medications can be like stimulants, antidepressants, or other drugs that help manage disruptive behavior. Finally, it is concluded that oppositional defined disorder is a behavioral disorder that is mainly seen in children and adolescents, where the persistent patterns of anger, irritability, defiance, and argumentativeness towards authority figures occurs frequently. Early identification and proper interventions are more essential to prevent the development of serious behavioral or emotional problems. So, with consistent parenting strategies, behavioral therapy, supportive environment, children with ODD can learn better coping skills and positive ways to express emotions, leading to improved relationship and long term adjustment. Thank you.